In chapter 20, we are moving on to diseases of the nervous system. First, starting out with the defenses that we see in the nervous system. So they're mainly structural, just meaning, of course, we have the bony casing. So we have the skull and the vertebrae that protect the brain and the spinal cord from injury. The cerebral spinal fluid helps cushion any impact that can occur. And then we also have the blood-brain barrier. And these are cells that make up the walls of the blood vessel, and it only allows very few molecules to actually cross through. And why that's significant here is that most microorganisms are prohibited from passing, which is good as far as causing an infection in the nervous system. However, that also means that getting drugs and antibiotics, if that happens, into the nervous system is also very difficult. And because of the importance of the central nervous system being vital, just like we had seen with the eyes and our vision, there's immune privilege. And that doesn't mean that we have an enhanced immunity. It's actually the opposite. So what happens here is, again, because the CNS is vital, we don't want any damage to occur from the immune response. So again, inflammation from just from a bacteria that's not very harmful could cause huge problems in the central nervous system. So because of that, there's very little immunity in the brain. So it has lower levels of those MHC, so it doesn't present a whole lot, trying not to activate the immune system. Also very few complement proteins, again, so we want to decrease the chance of inflammation and activation of that immune response. Also, because of that blood-brain barrier, there is no normal biota in the nervous system. So it's a sterile environment, so finding any microorganism is considered to be a disease or deviation from a healthy state. So there is no normal biota, normal flora in the nervous system. Now there are some certain viruses, as we talked about, that can kind of be in a latent, dormant state. So like the herpes simplex virus. So they can exist there. However, that's not considered part of the normal flora. That's a different phenomena. All right, so moving into the infections of the brain. So mainly talking about meningitis and encephalopathies. So meningitis is an inflammation of the meninges, which is the layer around the central nervous system. So there are thin layers that cover the brain and the spinal cord. So this creates an anatomical syndrome. So different microbes cause meningitis and they all look the same. So there are symptoms and syndromes. Doesn't matter if it's viral or bacterial, they all kind of look the same. It's just an infection of the meninges. And sometimes there's even non-infectious causes for the meninges to become inflamed, but it's very uncommon. Now, the most serious forms of acute meningitis are caused by bacteria. Again, others can, but the ones we worry the most about are bacterial meningitis. And then again, getting into the central nervous system is inhibited because of the blood-brain barrier. So typically entrance is facilitated by a co-infection. So again, it's going on with something else or a previous infection. So we'll see an example here in a little bit. So for example, Neisseria meningitis. So Neisseria is a diplococcus. So we have two cocci that are side by side here. This is also called meningococcus. This causes the most serious form of acute meningitis. And the reason for that is it produces an endotoxin, and that endotoxin is a potent white blood cell stimulator. So remember endotoxin, that LPS, gram negative. So remember gram negatives have that lipopolysaccharide, that endotoxin. So it's not released, it's not a toxin that gets made and then secreted to cause an infect. It's part of the cell, it's part of that lipopolysaccharide. But that presence activates the white blood cells, and those chemical messengers, cytokines, released by the white blood cells cause the vascular system to collapse, leads to hemorrhaging or bleeding out. And then also on the skin, it causes these petechia that we had talked a little bit about with our skin infection. So it's almost like a little rash. They're little red bumps due to the collapse of that vascular tissue, but those are seen throughout the body. Now, again, how this gets into the nervous system is it can disseminate with a nasopharyngeal infection, so like a sinus infection. And that's what we see here. So here where that Neisseria meningitidis was, so it was causing like a sinus infection. Due to its location, though, it can actually disseminate or kind of move into that cerebral, into the central nervous system to cause that infection there of the meninges. Now, meningitis is also caused by Streptococcus pneumonia, which, as the name implies, causes a lot of pneumonia, which is what it was named for. This is also called pneumococcus. We have meningococcus and pneumococcus. This is actually, even though it's most related to pneumonia, this is actually the most common cause of meningitis. So just if you get this from direct contact in your environment, the most common cause is from this bacterial infection. And it can be distinguished between the Neisseria because it does not form the petechiae. It has a capsule. So we talk about virulence factors. Again, the capsule, that sugary layer, protects it against phagocytosis. It kind of hides it. And other virulence factors, it creates alpha hemolysin, which breaks down red blood cells. It can also produce hydrogen peroxide that's toxic, and both of those destroy the central nervous system. And there is vaccination available against this form. Now, the most severe form of meningitis, though thankfully not as common, is actually Haemophilus influenza. So we have Streptococcus pneumonia that's related to pneumonia. This one, as the name implies, is related to the flu, but it's actually a misnomer because the flu is caused by a virus. But this bacteria here, again, another gram-negative Coccobacillus, so it looks kind of like a circle, but kind of like a rod somewhere in between. Again, it is the most severe form of meningitis in humans. The most common is the serotype B, so it's called Hib. That's what causes most of our infections. However, Haya, which is the serotype A, is starting to pop up, also aggressive in the disease. Thankfully, though, vaccination has reduced asymptomatic carrier of this. So again, those who may have been exposed to this, may be carrying it, but don't actually have the disease, has helped to eliminate that stereotype B in the United States. Another cause of meningitis is Listeria monocytogenes. This is actually gram-positive instead of gram-negative, another Coccobacilli. But it also has kind of a palisade formation, so it forms more like the cubes it can form. It does not produce capsules or spores, but it is flagellated, so it can move. It's resistant to a lot of things like cold and heat, salt, pH, and bile. It's also not fastidious, meaning it can't switch between aerobic and anaerobic, so it is a little picky. But it grows inside of the host cell, and because of that flagella, it actually doesn't have to leave the host cell. So it can go directly from one infected cell to a healthy cell without going through the blood. So that kind of hides it from our immune cells, so they're not as likely to detect it. Now, this also causes listeriosis, which is typically mild or subclinical in adult populations. Again, it can infect the brain and the meninges, which leads to that meningitis if the individuals are immunocompromised or old, or in infants or neonate, or in fetuses or neonates. And because, and that's due to its ability to cross the placenta. So again, if a healthy mom, pregnant mom, is exposed to this, the mom would be okay. They can fight it off fine. However, it can pass to the placenta and cause a premature abortion or even fetal death. And it's pretty, its morbidity is pretty high, so about 20% of those cases. So for this reason, pregnant women are told to avoid certain things like unpasteurized dairy products. Now, if it's been pasteurized, like drinking milk is fine, but non-pasteurized, so different cheeses like on charcuterie boards, some of those should be avoided. Also in poultry and meats, especially like lunch meats. So those should be avoided during pregnancy as well, because they can have this. And again, if a normal healthy person is exposed to those, they're fine and asymptomatic. Again, the concern is mainly in immunocompromised and in pregnant women, so they don't pass that on to the fetus. Now, meningitis can be caused by viruses. So about 4 of the 5 cases are caused by one or more of a variety of viruses. A lot of time this can be aseptic meningitis, which is viral meningitis, where the symptoms look like meningitis, but essentially there's no bacteria, fungi, or protists. So there's not really a way to detect it to prove that that's what it is. So essentially we just rule out everything else. And if there's clearly meningitis and symptoms of the inflammation of the meninges, but we can't detect anything else, it's determined to be viral. And this is what causes the majority of cases in children, is actually an enterovirus. So again, viral meningitis predominantly is caused by an enterovirus. Now the herpes simplex virus 2 can sometimes cause meningitis, some of the other forms as well. And HIV can also look like meningitis. However, it is not. It's just due to some other symptoms. It's not actually an infection of the meninges. And then just kind of looking at, so again, generally milder than the bacterial or fungal meningitis. So typically goes away in a couple weeks. So less than like 1% mortality with this. So again, enteroviruses most common, especially in children, that leads to viral meningitis, but thankfully it's less harmful than what the bacterial types we just talked about are. So our summary table here, so again, Neisseria meningitis, streptococcus, pneumonia, and then Haemophilus influenza. So again, droplet contact for all of these. Now we talked about with the, remember we were talking about the skin infections, we said most droplets are carrying viruses, but these are an exception here to where we can get droplet contact. Again, the reason for the droplets being the issue is that nasopharyngeal connection. So again, if we have inhalation of a droplet, puts it close to that nasal passage that allows it to travel to the meninges. And again, just some of the virulence, so all of them have that capsule that helps hide them from phagocytosis. Neisseria, though, also has the endotoxin, that LPS, that's in there. And the streptococcus produces the hemolysin and hydrogen peroxide that destroys the brain. Now, neonatal and infant meningitis, talk about a little bit separately here. This is usually transmitted by the mom in utero. So it's that vector or that vertical transmission from mom to the baby during passage through the birth canal. So as more and more premature babies survive, we're seeing this increase. And unfortunately, the morbidity has increased, but the mortality has decreased. So they have more problems, but they're more likely to survive. So morbidity is talking about how sick they are. Mortality is the rate of death. So they become very sick, but typically survive. Now, neonatal and infant meningitis, though, because being transmitted not from droplets, but more from vertical transmission from the mom, it is mainly caused by Streptococcus agalacti, or E. coli, again, as they pick up as they move through that birth canal, and also that Listeria monocytogenes can also cause neonatal and infant meningitis as well. Now moving into meningoencephalitis. So here we're combining meningitis, infection of the meninges, with encephalitis, which is an infection of the brain. So here we have both an infection of the meninges and an infection of the brain. And this is just due to that close association with the brain to the meninges. And these are caused by amoebas. And amoebas are protist, so we don't talk a lot about them with infections, which is why we're talking about them here. And we'll focus here on the Naegleria fowleri is the main one that we're going to focus on. So it is a small flask-like amoeba. It moves by a pseudopod, which is like a false foot. Kind of looks a little bit pretty funny, actually. But anyways, it's rounded. It can form a thick wall cyst, so it becomes resistant to different temperature extremes. Not as resistant as an endospore, but it does go into this dormant cyst stage that allows it to resist various like chlorination, disinfections, as well as temperatures. Now, where this can lead to infection of the central nervous system is these amoebas get forced into the nasal passage. They utilize the olfactory nerve, which is what helps us with our smell. So they actually travel along that olfactory nerve to get to the brain. Unfortunately, these are very destructive. They cause rapid and massive destruction. So treatment is actually futile in these cases. Thankfully, though, at least in the United States, these cases are rare. Those that have been reported mainly come from swimming in areas or freshwater that have these, or actually in contaminated water that was used in a slip and slide. So again, sliding down, the water goes up the nose. And if it has, especially the cyst in them, they can lead to the infection. And then also a few from using neti pots with non-sterile water. Again, just that passage through the nasal system, just like we had seen with meningitis, that closeness of the nasal cavity or nasal passage to the meninges or to the brain using the olfactory nerve allows that passage to occur. Now, if we switch over to encephalitis, which just now infection of the brain, not the meninges as well, these are almost always caused by viral infections. Okay, so bacteria usually, at least the serious forms, we're talking about with meningitis. When we talk about encephalitis and infection of the brain, most of these are caused by viruses. So we see things like behavior changes, decreased consciousness, or a seizure, but it does behave a lot like meningitis. And it is treatable, though. The majority of the viruses can be treated with a cyclovir that alters the ability of those viruses to replicate. Now, the most common of those viruses are arboviruses, and these are transmitted by arthropod vectors, so like ticks and fleas. There is worldwide distribution of these viruses, and those warm-blooded hosts kind of maintain them during the cold and dry season, whenever typically the viruses would be denatured. There are millions of infections of this per year, and many of them are fatal, leading to thousands of deaths. Unfortunately, even with the acyclovir, there's no satisfactory treatment for most of these. The herpes simplex virus 1 and 2, these can cause encephalitis, especially in newborns where they get it vertically transmitted from their mom. So it is disseminated throughout the body, and that progress is poor. So older children and younger adults, and those over 50, so the young and the old, so the extent extremes of our age are more susceptible to it. And it's usually caused by herpes simplex 1 more so than 2. And this is going to occur during that reactivation of a dormant infection that then allows it to manifest and multiply in the nervous system. So our summary table again, the majority caused by arboviruses, so like West Nile virus, Powassan virus. Again, there are many others as well. This JC virus. So all of these are transmitted by vectors. So controlling insects is a way of preventing them. Again, though, treatment for those, there isn't any. This can also be considered a bioterrorism agent as well. And then the herpes simplex 1 or 2, again, vertical or reactivation transmission is how that occurs. Acyclovir, though, can be used as a treatment for these, as well as just screening the mom to help prevent any transmission.